One of the big questions asked for the last couple of years is all these doctors and even nurses in Canada that were trained abroad, but they're living here now and they're idle. How do we put them to use? And one approach, I don't know if it was Polyev, but establishing a certification system that will standardize a test for doctors, specialists, nurses to get them to work.
Yeah.
Do you think that's a good idea?
Of course. Yeah, they need to. They need a proper certification, no question. Can't have anybody doing it, but I think they can up it up more. Liberal government did not do that. They did not show their ability to, particularly when they play around with capital gains and discouraged existing physicians to pay more money from capital gain taxes. And
did they increase it to 66% now?
I don't know what happened in the end.
Did it officially become, or did they put it off? I'm trying to remember. I don't remember if they.
I think somewhere in between.
That's insane, man.
I know. And so they need to put more money into training physicians, getting more, looking at specialists, and so. I had to laugh when they talked about building the new Ottawa Civic Hospital. Sure, they get money and they look at the room distribution, they look at other things, but what they didn't do properly is look at increasing the number of doctors going into that facility.
Right.
Because I attended a foundation meeting and I kept on. How about?
Yeah.
Yeah.
It is interesting though to ponder and ask the question there is a difference though between the health education between various countries. So it is a legit question to say okay, if there's a doctor that was trained, I don't know, in Belarus or Nigeria. I know there's a lot of Nigerian doctors born in Canada.
Turkey and Somalia.
Turkey,
I know.
There's got to be some sort of standard, because it can't be. They're not on par.
Let them set the standard.
Right. Let them set the standard, and then.
But they don't do that. They just talk about it, but they don't do it.
Yeah. It's interesting. I find it interesting though that. Canada's not producing enough of these specialists. We're only 30 million, but I'm surprised there's still not more doctors and nurses.
On top of that,
from Canada,
they have problems with remote areas.
For sure.
And how they fixing that problem?
Yeah.
They finally got smart about one thing, and it's taken them all these years. They said, "Oh, by the way, we have how many provinces and how many territories? So basically, we end up here with 13 healthcare systems. Who needs 13 healthcare? Why don't they rewrite the Constitution, get rid of the provinces, and just have one province?"
Just one national system.
Oh, it's I can't believe. So that's part. But one thing they just realized, if we want to trade between provinces, we could do this. They're all excited. What took them so long to want to do this?
Yeah. Well, at least one province will object to that for sure.
Yeah, which would be
Quebec, right?
No, maybe
I would say Quebec.
No. Maybe more than one province.
You say Alberta?
Yeah. Yeah. I think I like the lady there. I like the way she thinks. I like people who think out of the box a little bit. We think within the box.
Yeah.
And that's what we got.
Yeah. Quebec is probably the most bureaucratic system in Canada. Okay, so let's say you have some, you've already mentioned, but you have like 3 amazing recommendations that will drastically improve the healthcare system in Ontario. What would they be? To summarize 3.
Okay. Certainly increasing the number and quality of physicians, both primary care and specialists. That they should work in an environment of multi physicians, so they could also interact with each other. And I guess more funding to do auxiliary stuff would be the 3 main issues. And in that, I mean also education program for better physicians, and to be able to talk to each other.
Yeah, it's
called communication.
How likely do you think these 3 things will happen, I don't know, the next 10 years?
I don't see any major improvements.